So my name is Shelli Hardy. I am one of the clinical dietitians at UT Southwestern, and I deal specifically with patients receiving chemotherapy as well as surgical resection, and I get to deal just with the patients with cancers of the GI system. So that's a great privilege we have at UT Southwestern to kind of specialize with nutrition. So in a minute, I think I'm going to come down here and talk to you. So make sure I'm on the same page. Thank you. All righty. So today, of course, we're going to cover nutrition specifically for patients with cancers of gastric cancers. And what I'd like to go through are, first of all, why is nutrition so important early on in treatment? Some common nutrition-related side effects of some of the treatments. And then we'll talk about surgical resection separately, and that's a big bunch of nutrition complications often. And then we'll switch gears and we'll look at what are some recommendations to help reduce risk of recurrence. And then I'd like to talk about specifics. What are some dietary patterns that are helpful? First of all, why is the early intervention so important? We know that sometimes with gastric cancer, the symptoms are vague, so they mimic other more common conditions, and so diagnosis can be delayed, and we often get a lot of weight loss with that. So quite honestly, the majority of our patients are coming into that first treatment already with weight loss. And some of these patients are actually clinically malnourished. So we need to start early. That first chemotherapy appointment is when I'm seeing my patients most often. So lots of possible therapies that we've heard here. We know that most patients have at least 2 of those therapies. So kind of first we're going to talk about what are the nutrition-related side effects of radiation therapy, chemotherapy, and immunotherapy kind of clumped together. So first of all, one of the main things I often hear is I'm just not hungry, or I'm taking 2 bites of something and I'm full already. So that's the early satiety we talk about. No way around this. We need to move to those small, frequent snacks, and the important thing here is all of those should be protein rich. So you're going to hear a lot about protein today. We know that coming into treatment with the cancer diagnosis, your protein needs are probably almost doubled. And so there's no way around getting those protein sources into every snack that you're eating. Don't wait for those hunger cues. So we're so used to waiting till we feel hungry. If you do that in this situation, you'll get to the end of the day with no calories, which is not good. Light activity can sometimes help stimulate the appetite, so walking does not have to be rigorous, just light activity. And then sometimes my patients will tell me drinking their calories is easier. So here's where we go to those high calorie, think Ensure type products, but we have a lot more where that came from nowadays, thankfully. And then the high calorie soups are ones that I like to promote, especially as the weather gets cooler. Nausea and vomiting, that one is a tricky one because really, quite honestly, we need medications to manage that. If nausea is triggered by things like smells, we can work through those things together. Of course, we want to limit the smells. We'll cook in the microwave. We want to eat light foods, cool foods. Sometimes non-greasy foods are better. One tricky thing that we run into sometimes is something we call anticipatory nausea. So you feel hungry, you think you're going to be able to eat, and then you see the food or the food comes to the mouth and you get gagging or retching associated with that. For that situation, often medications are appropriate, but from my perspective, we work on behavioral strategies. So what can we do to distract you from those thoughts? Can we eat with other people? Can we watch TV? Can we talk on the phone? Whatever you need to do there. So this is a big one I deal with, the loose stools or the diarrhea. And half the battle here from my perspective is looking at what is the cause, what is the source of this. So we'll evaluate the diet. Is it high in that insoluble fiber, the fiber that moves quickly through the system? Could it be the patient was on antibiotics, or is there an infection, sometimes malabsorption kind of issues? General guidelines include reducing that insoluble fiber. In a perfect world, I'd like to increase the soluble fiber, and that's the fiber in things like oatmeal and barley and things that can absorb some of that fluid. That can be difficult. So from my perspective, we'll look at products like Banatral Plus, which is just those banana flakes that are treated with a prebiotic component, can be very helpful. Probiotics are a pretty exciting area of study now. We know that can we identify the source of the diarrhea? Often a particular strain of a probiotic is more effective, and so we can recommend a particular product to help with that. Of course, things like Imodium, things that slow motility can be helpful here. And then rehydrating with low sugar oral electrolyte replacement drink. One I like really well is called Drip Drop. It's made, a lot of the runners use it, but it actually tastes good and it rehydrates really well. So the other side of that is constipation. We get patients, of course, on pain medications and inactive. So I'll always recommend the high fluids. Make sure you're getting enough of those. If you can move, activity is helpful. Fiber, here's where we want that insoluble fiber, those raw vegetables, that skin of the fruit is helpful here. So mouth sores, here prevention is always best. So using the baking soda salt rinse, and we have recipes for that, is an easy way. If you're not on a chemotherapy agent that causes cold sensitivity, sucking on ice during treatment can sometimes be effective. After you get the mouth sores, here's where we want to go to the low acid foods, not spicy, and kind of just treat until the symptoms improve. Dry mouth and taste changes, from my perspective, here we are usually getting more taste change problems, and this is really individualized what works. Some people, it is the citrus flavors, so if your water tastes strange like metal, freeze some fruits, put those in your water. Go from there. Different seasonings, sometimes people get no taste, so spicy works, or sweet doesn't taste good, so just working through those things. And lastly, as far as most common side effect for chemotherapy overall is fatigue. And from a nutrition point of view, we want to keep your environment so that you can address this issue. Keep those high-calorie, high-protein snacks available. We want at least 4 to 5 available at all times because of the taste changes and so forth. Sometimes you think you want one thing and you can't eat that thing. Stay active. This helps. Stay hydrated. Dehydration can make you feel tired for sure. And then take advantage of those times when you do have more energy. So is breakfast the best time? For some people that's true. So eat your eggs, eat your oatmeal with your nuts on it. And you can get your protein and your calories in. So gastrectomy, if you're going to have surgery, I think this period when you're preparing for surgery is one of the most important periods. Kind of like training for a marathon. What can we do to get you ready for this big procedure? And again, with the protein, you want that to be adequate. You want to stay well hydrated. Activity is really important here. So have you lost that lean muscle mass? Can we rebuild that at this time? Or can you preserve what you do have? So light resistance, whatever's, your doctor says you can do it, let's do it. This is the time. I'm often recommending an immunotherapy drink. Impact Advanced Recovery is the one I prefer. It's appropriate for diabetics. It's very high in protein, but that's not the secret. Some other ingredients, specific amino acids, fish oil, that help reduce the risk of infectious complications with the big GI surgery specifically, and also showing to reduce length of hospital stay. And that's important when we can manage that. So that period after surgery, anybody's had a gastrectomy, they know this is the critical period. So often a feeding tube is placed here. And I like that, of course, because it's a way I can ensure you get the right amount of calories and protein in. And the 6 small meals a day, there is no way around that. There's no way to shortcut that. You want to take little bites, chew well, eat slowly. Kind of think we want to keep this food in your system as long as we can so you can absorb what you need from that. Drink fluids separately from your eating. So you're thinking, what can we do to not flush everything through too quickly? Some patients will lie down after eating, so sometimes just 15 minutes will do the trick. And then here we want to restrict that fiber. We want everything to heal really well. Here's where I want you to be working with a dietitian if this is where you are, because I don't want to eliminate or restrict any more than I have to, because we want you to gain weight here, not lose weight. Some people will become lactose intolerant. Some people will need to watch their fats, or rather than really restrict fat, I would like for you to be able to comfortably digest it. So sometimes pancreatic enzymes will be effective, not because your pancreas isn't producing enzymes, but because things are moving so quickly through and the particles of food are larger. So sometimes that's appropriate. Talk to your doctor about that. Most common thing I'm seeing in this list is called dumping syndrome. So real high sugar items just get too quickly into the intestine, bring water into that bowel and cause diarrhea. That is early dumping syndrome. There's also late dumping syndrome, which the same effect will result in a low blood sugar and give you that shakiness, dizziness. So we want to avoid those things, but again, only restrict what we need. This next period, the next 6 to 8 weeks, is usually a better period for eating. Often we can start adding things back in. So I'll have patients saying they've really been craving a certain food. The only caution I would use is do things slowly. Do real small quantities, like 1/4 of a cup at a time, and wait and see how you do. We want the least amount of negative symptoms around food that we can have. So some patients will keep a food symptom log. I ate this thing at this time, and this, I had diarrhea, or I felt great, whichever thing occurs, because then when you go back to your dietitian, you can say specifically what's going on, and we can start to find patterns. Last thing on gastrectomies are lifelong recommendations for vitamins and minerals. I'll usually recommend a chewable or liquid multivitamin with iron. Iron deficiency is the #1 symptom of deficiency early on after gastrectomy. But calcium and vitamin D important for bone health long term. And then vitamin B12 is tricky, because often people will get their levels checked and they'll be fine for a while, but deficiency does not show up for at least a year usually, so don't become complacent with this. Continue those B12 injections, really, really important. Then to switch gears a little bit, two really important organizations, the World Cancer Research Fund, along with the American Institute for Cancer Research, they partner and they look at all the lifestyle and nutrition research in the world, and then they make some recommendations. So specifically for gastric cancer, the 2016 was the latest update, and what they show for risk is for the upper stomach cancers, BMI or body fatness is a risk. For all kinds of stomach cancer, alcoholic drinks of more than 3 a day showed a risk, as well as salting foods, salt-preserved foods. And then for the lower stomach cancers, processed meat. So this is where the pepperoni, the bacon, the sausage, those kinds of things. Same organizations work together, and these are risks for overall cancer reduction. And the reason I put this up there is if you look at number 10, this is for cancer survivors. What is the recommendation to reduce risk of recurrence? Once you're diagnosed with cancer, you're considered a cancer survivor. So be a healthy weight without being underweight. Exercise, really important. 30 minutes a day is the recommendation, and this does not have to be rigorous, but we know to help that immune response, to lower that systemic inflammation, you cannot shortcut exercise. Fruits and vegetables, whole grains and beans, obviously really important, as well as lowering those high-calorie foods, sugary drinks, so sodas, sweet teas, juice, not recommended. red meat is really interesting. They are looking at all the researchers saying not more than 18 ounces a week, which is a fair amount, but this does include beef and lamb and pork as well. We want to limit intake of salty foods. We saw that with some of the stomach research. Limit alcoholic drinks, no more than 2 a day for men, 1 a day for women, and that's independent of size. So that's how we metabolize alcohol. Really important one at the Cancer Center that I come up against a lot is the supplement question. So supplements are not effective in prevention of cancer. They can be dangerous during treatment. They're not well regulated, and so we really worry about that interacting with your treatment and causing you harm. So we look at that closely. Now, in deficiency, certainly things like vitamin D, iron, those are perfectly acceptable and advised. So is there one recommended diet? And the truth is there are several diets that can help you meet these goals. I'll just talk about 2 briefly. The first one I like because of the simplicity of it is basically fill 2/3 of your plate with those healthy foods. So your fruits, your vegetables, your whole grains, your beans, and then just 1/3 of your plate should be animal protein. You also want to watch your portions. So this may be just have a 9-inch plate instead of a 12-inch plate. Watch how many times a day you're eating. And this is after treatment when we look at things like this. My favorite, hands down, is the Mediterranean-style diet. I think there is no other dietary pattern that has been so well studied for prevention of not only cancers, but also for heart disease, diabetes, dementia even. It's well studied. And the base, or the big part of this diet, is physical exercise. So that activity every day, doing something, again, does not have to be rigorous, but walk, play with your kids, ride your bike. The core of the diet itself is whole grains, fruits, vegetables, nuts, seeds, those healthy fats, so avocado, olive oil, really important. Seafood is important on this diet, so a couple times a week, those fatty fish like salmon and tuna, sardines, mackerel, so think of the omega-3s, those also reduce systemic inflammation. Moderate intake of lean proteins like chicken, Greek yogurt's great, eggs, and cheese. And then the meats and the sweets are the treats. So that's the top of the pyramid. So processed foods, things you can get through a drive-through, those kind of things. And I will say this diet does such a good job at reducing kind of that systemic inflammation that if I have a patient eating well on treatment, I will recommend this. But hear me say very clearly that the most important thing I want to see is to stop weight loss. So if you're not eating well, the most important thing always has to be calories and protein. And then within that, when you can implement these things, they're a good idea. But remembering priorities. So the takeaway today, one of which is really important, working with a registered dietitian wherever you are in your journey. Most cancer centers, you will have access to one. Sometimes it's on a consult basis, so checking with your center. And then if you can't find one, our academy, the Academy of Nutrition and Dietetics, the website eatright.org, you can click on Find an Expert, and you can put in your zip code, and they'll find someone in your area. So that's all. Thank you so much for having me. It's been an honor.